A packed night, ladies and gentlemen. The room is packed out. We've got 500 participants, and ladies and gentlemen, you are here and you're going to hear it. So we're super excited to have each and every one of you with us. Let's go ahead and get started. My name is Dr. Troy Sanford, and we have a blockbuster news for you tonight, going to be delivered by the chairman, Mr. Joseph P. Urso. You're also going to hear from Dr. Omar Hamada, who just finished with his shift in the emergency room. He's an emergency room physician. He's going to share his perspective on everything that's going on tonight. And we're going to finish with Robia Turner, brand new Platinum 5 executive. So with no further ado, we're going to turn this over to the chairman. Now, Joseph P. Urso has every personal quality and professional quality to execute his duties. Joe Urso is making the decisions, and he is the undisputed leader of Vollara. Welcome to the call, Mr. Urso.
Hey, Dr. Troy. Thank you, sir. And what a night. I don't know if you know, but we just tapped out the lines. There are probably people that aren't getting in. But tonight, we have two really amazing pieces of good news. Oh, geez. Troy, you know everything. I can't tell you everything, but let me tell you what I can tell you. The first piece of good news is we just got back amazing off-the-chart test results where we tested the Vollara Air and Surface Pro against airborne SARS-CoV-2 virus at a combined biosafety level 3 and 4 laboratory that honestly is almost completely dedicated to military and CDC work right now. They thought our technology was so important that they snuck us in to work and see what we could do to make a difference. And that news will be released this week. We're working on the final data. I can tell you, it's almost hard to believe it's so good. Keep your eyes out. By the way, if you're not signed up for real-time messaging with us, Troy's going to tell you how to do that. Because when that comes out, I think it's going to come out public on Thursday. You're going to want to know about it. Okay, the details are mind-boggling. I will also tell you this: we are in the process of being. There will be a major article with us in a major media release next week about this. So it's not going to just be a press release floating around. There's going to be, frankly, global news about what we're doing, and you guys are at the forefront of it. So this is a good time to start thinking about what you want to accomplish between now and year end, between now and the holidays, and as you go into next year, because there's going to be a big tailwind behind you. Okay. And there's even more to come, but I'm just going to stop there for now on that. The second thing is we have initiated a double-blind clinical study with one of the leading hospitals in the world. And I'll tell you who it is. It's the Cleveland Clinic. The Cleveland Clinic has asked and worked with us to see how powerful our technology can be to help reduce hospital-acquired infection. Our facts are, guys, that we're doing a double-blind clinical study at the Cleveland Clinic. And I think, Dr. Troy, you have some slides that might walk us through this.
Yes,
so the
sir.
clinic is trying to figure out how will our technology reduce hospital-acquired infections? This is a multi-billion-dollar issue. More importantly, it affects hundreds of thousands of lives every year. It takes a lot of them too. And Dr. Hamada has agreed to come on and share some of his absolutely amazing professional knowledge and insights about the significance of this. Troy, go to the next slide for me.
Yes, sir.
And so the way this works, this is a global study in the sense that it's being reported globally, and there's a registration site. And the way it works is we're going to have to do a test on about 80,000 patients. And the reason that it's so many is because of the statistics. You're looking for a statistically significant reduction. But it's a really big deal, guys. The next slide will tell you a little bit more. Troy, if you don't mind, please. The way it works is half the patients get the active technology, half of them get a placebo. But nobody knows who has which. It's a randomized test. It's all coded. And there's only one person in the entire facility that has any idea what's really going on here. Please go to the next slide, Doctor. So the way it works, they're trying to determine, okay, how can we reduce the number of people that are injured, the number of people that get an infection, the number of people that die. And as I said, it's literally over 100,000 just in the US, never mind globally. The next slide. And by the way, our system is about as good as it gets. It's not like some of these other countries. I was meeting with the health minister of Brazil last year. They have hospitals in Brazil where 25% of the patients leave with some kind of a surgical site infection. It's just, they don't have the wherewithal to deal with it the way we do here. And in this place, in the US, you're lucky if it's 5% is good. So we're trying to figure out all this stuff and what does it do to the cost of care? These are all very scientifically driven things. Dr. Choi, again, let's go through this relatively quickly. It's a 2-year study. That's how long it's going to take. But guys, we're doing something that hopefully can change the world. Dr. Choi, please keep going. Because our job and our mission. So Dr. Choi, we are really blessed tonight to have Dr. Hamada join us. And if those of you that don't know Dr. Hamada is a recognized hero of this country. He has served in this country and has been honored and has received numerous awards and medals for the service to our country. Currently, he is working as a frontline provider for hospital care, dealing with COVID patients and non-COVID patients in Tennessee, where he lives. And he's not just a great doctor, he's a great man. And I've been so fortunate and blessed to become a personal friend of his. He's agreed to join us tonight and share his insights with what's going on today, real time, frontline. Dr. Hamada, can you hear us? Can you join us? Are you with us?
Sure can. You bet. Am I off mute? Can you guys hear me?
We can. Yes, sir.
Fantastic. Actually, I just texted Troy right before this started and told him I had just gotten out of the ER. I've been working basically a shift a day for the past week or so. And they're 12-hour shifts, and it has just gone crazy. Probably half the patients I'm seeing are now COVID patients, and it's intense. Real time, and we're seeing these things every day, and they're overloading our hospitals and ERs. We're sleeping probably 40 patients tonight in our ER because our 250-bed hospital is full, and there are no beds. Probably a third of our nurses are out sick. So the staffing issues are a serious matter as well. So just from the coronavirus perspective, what we are doing at Vollara is something that is world-changing, and I can't wait for this to spread like wildfire throughout the country.
And Dr. Hamada, I think you know what the data is going to show. It's amazing. We tested the live SARS-CoV-2 virus and had literally results off the charts in just minutes. How important is that going to be as we fight this COVID battle?
Incredible. The issues, I think, are that there are so many people trying to come to market making false claims that haven't been proven, while ours has. And then there's a lot of skepticism as to how effective various claims are. But once we get a real foothold and people actually see what our products can do, I think the importance is going to be easy for anyone to see, because I'm really a firm believer. I've been in these people's faces every single day for the past 9 months that I've been at work. So I don't work every day, but every day I'm at work, I'm in their faces, literally inches away. And most of the time I don't have one with me, but really just a surgical mask, not an N95, but just a surgical mask. Some people are COVID positive, others you don't until later. But I know I've been exposed multiple times. So how much of it is how much of the transmission is actually respiratory? How much is actually contact? I'm starting to lean more towards much of it is actually contact, where it's going from your hands to your face inadvertently. So I think, with what we do, it's not just purifying the air, but it's also purifying surfaces, which is incredibly important because I think much of what this transmission is about contact transmission.
Wow. So our technology being an active technology, that submicroscopic molecules flying through the air at literally 600 to 1,200 feet per second, attacking the air and surfaces, is really potentially a game changer in our battle against this disease.
No question. no question.
Dr.
And I
Hamada, do you
thought,
think are these vaccines going to just fix and solve the day? What's your take on that, personally and professionally?
personally, if I'm being honest, I'm a little worried. I mean, this is a new technology that we haven't, new scientific technology that we haven't really used before. Theoretically, we know how it would work or how it could work, but we're using traditional models with another format, of immunization to produce these at a rapid pace. So with messenger RNA vaccinations, what I'm reading with Moderna and Pfizer, and I used to work for Pfizer. I worked for Pfizer for 4 years as a research scientist there, back probably 10 years ago or so. But what we're seeing from them is that the efficacy is 95%, 95%, but the length of time that it actually protects, Moderna came out earlier this week saying it might be only 3 months, 2 or 3 months. So until we have good safety data that's long-term, I'm a little cautious with regards to these immunizations. Now, if we had a fatality rate like Ebola, there's no question. I think everybody should get it. But personally, I think I'm gonna wait a little bit.
Okay, well, good to know. So, Dr. Hamada, who doesn't need our technology right now?
No one that I can think of. I was talking with Troy earlier, and he was telling me about a study that he'd looked at with aerosolization in a room. And one thing that a lot of people are making claims of is that, when you change the air several times an hour, 7, 8 times an hour, you're getting rid of particulate matter in the air. But what we're seeing in some of these studies is 90% of that particulate matter, microscopic particulate matter, is not cleared by air exchange, that it's actually still there, still in place. So I think it's essential that we have technology that can clean the air and clean surfaces when air exchange, simple air exchange is not actually doing it.
Dr. Hamada, I almost feel like we have a duty to share this technology with everyone we know. Could you comment on that? We have over 500 people on this call tonight, which is a new record for us. We probably could have had 1,000. And a lot of folks are new to what we're doing here. Could you perhaps just color on that and speak to your thoughts about my belief that really we have an obligation? It's not about the money. It's truly an obligation. It's a calling to share this technology to help people and help protect lives.
Sure. And I think it's a logical matter. If this technology does what we claim it does, and we know it does, then I agree we have an obligation to share it because, not just coronavirus, but so many other bacterial and viral and fungal and mold pathologies or pathogens. If we know that it cleans and kills those pathogens on surfaces in the air, I think we do have an obligation to actually share it because this is causing significant disease. Corona is causing significant disease. Influenza causes significant disease. Many other airborne pathogens cause significant disease, including mold.
Now, I've had a couple of friends put the technology in their homes. One family member has gotten the virus and they haven't. Is it powerful enough, in your opinion, and I have the science to know, and I know you don't have all the data, but is it not likely that by having the technology in the home, you're significantly reducing exposure and increasing your chances of protecting yourselves?
Again, no question in my opinion, primarily because I believe most of the transmission is actually contact related. But even with aerosolization, with as rapidly as ActivePure technology clears these pathogens from the air and the surfaces, I think it's going to significantly reduce transmissibility in the home. And actually, that's where the CDC says it most occurs, right? Not out when we're eating in restaurants or wherever. Most of the transmission, the CDC says, occurs in the home.
Yeah, it's very logical. Dr. Hamada, before we switch back to Troy, because I know he has some things to cover, anything you'd like to add in closing today?
I'm incredibly excited about this, both as an individual, as an entrepreneur, and as a physician, as a scientist. And I think it is not just world-changing, but also individual life-changing. It has the potential to be. We talk about things that can save lives. This can actually save lives. I think this is more powerful than masks. I think it's more powerful than social distancing. I think it's more powerful than washing your hands. I think what we know this stuff does, it's a world changer.
Wow. Thanks, Dr. Hamada. We're so grateful for you're taking the time, especially working these endless hours and out there saving lives yourself real time. We're so grateful and thankful to you for your contribution. And with that, Troy, we'll come back to you. And I know you have other things to talk about tonight.
Thank you so much, Joe. Thank you so much. Thank you so much, Dr. Hamada. Wow, what an incredible perspective from seeing what you're seeing. We're going to change gears and go now to a